Hi, I'm Dr. Doctor. Let's talk about fibroids. So fibroids are benign or non-cancerous growths that develop in the muscle of the uterus. While we don't know the exact cause of fibroids, we do know that fibroids are influenced by hormones such as progesterone and estrogen, as well as genetics. So if your mother and your sister has fibroids, your risks are higher. The good news is that while fibroids are incredibly common, they're very treatable when they do become a problem. The most common symptom for uterine fibroids is heavy menstrual bleeding, but patients can also experience pelvic pressure, they can experience frequent urination, constipation, as well as a fullness in the lower abdomen. That said, many patients with fibroids never have any symptoms. It really just depends on the size, the number, and the location of the fibroid. Fibroids don't usually disappear, especially during the reproductive years, but they often shrink in menopause because of the decline in estrogen levels. Fibroids can affect fertility, but not all fibroids do. It really just depends on the fibroid and whether it changes the shape of the uterine cavity. Believe it or not, many women with fibroids do become pregnant without difficulty. So finding a fibroid doesn't automatically mean you're going to have fertility issues. The key is having an individualized evaluation to determine if treatment is necessary. The good news is fibroids are very treatable and we have more options than ever before. If you're experiencing mild symptoms related to your fibroids, we have medications that can help with that. There are also minimally invasive options that can shrink the fibroid. If fertility is your goal, there's also the option of a myomectomy that can remove the fibroid but still leave the uterus intact. And for patients who are done having children and looking for a more permanent option, the hysterectomy is a definitive treatment. Whatever option you choose, it's going to be based on the patient's age, symptoms, and plans for future fertility. There's no proven way to prevent fibroids because so much of it is influenced by genetics and hormones. However, maintaining a healthy weight, eating a well-balanced diet, and staying physically active can help to lower your risk. While fibroids are incredibly common, do not ignore the symptoms. These symptoms are not something that you have to live with. An earlier evaluation often gives us more options to treat the fibroids. So talk to your healthcare provider.